This slide, we have the practices to avoid. On page 282, you'll see complications in table 10.6 related to cigarette smoking. The nicotine and cyanide in the cigarettes are toxic to the fetus, so secondhand smoke can also be an issue. Blood flow is restricted. We have a lower birth weight, decreased nutrient and oxygen being pulled across the placenta, and babies that are born to smokers have a greater risk of SIDS, which is sudden infant death syndrome. Page 284, we see the start of the different terms related to alcohol abuse and pregnancy. So you'll see things like FAS, fetal alcohol syndrome, FASD, ARND, ARBD, and you'll utilize some of those terms for your case studies. But I do want to point out that in the Blackboard section for this week, there is a CDC podcast, and it's very fascinating to me. This is the CDC recommendation of safe alcohol. And in 2006, they finally became rather stern in their recommendations for alcohol. In the past, it had been, well, women of that are pregnant should avoid alcohol or use it only in moderation. Well, 2006, they came hard and fast, and they said women of childbearing age, not just pregnant women, should avoid alcohol. So I thought that that was really interesting to have those hard and fast recommendations, and you can read more about that rationale or listen about that rationale in that podcast. I highly recommend it. It's really interesting and easy, fast listen. Then we have environmental contaminants like lead and mercury that we might find in fish like shark, tilefish, swordfish, king mackerel. Seafood consumption recommendations you can find on page 289, table 10.8, but basically we want moms to get seafood because of the omega-3s, lean source of protein. So about 8 to 12 ounces per week of fish that are low in mercury. No more than 6 ounces of canned tuna per week, and no fish oil supplementation is recommended. Foodborne illness that we'll want to counsel moms about, listeria. This we have heard a lot about with things like cantaloupe, soft unpasteurized cheeses like feta, queso, blue cheese, bean sprouts. That's one of the reasons why you don't see them on salad bars, because they have a high incidence of listeria. Lunch meats, ice cream, recent listeria outbreaks. So the exposure to listeria can cause miscarriage, stillbirth, severe brain injury, or other infections to the fetus and the newborn. So it's really important to counsel moms on avoiding these foods. If they are going to have lunch meats, they should just boil them or microwave them. Same with hot dogs before eating. Mom should be advised to not have megadoses of vitamins unless under the supervision of a physician. They shouldn't be doing fad diets during pregnancy. Sugar substitutes, it does show that they are GRAS, generally recognized as safe. But really, we want moms to focus on whole foods and getting the most of their nutrition by choosing nutrient-dense foods. And then caffeine, less than 200 milligrams per day is safe. If mom's consuming more than that, we have a decreased absorption of iron, reduced placental blood flow, increased risk of spontaneous abortion, low birth weight, and then once baby's born, some withdrawal symptoms. If you go to Appendix A in your book, you can see the caffeine content of certain common foods if you'd like more information about that. And then next we're going to talk about adolescent pregnancy. I'm going to stop this video now and start it.